Hi, good afternoon. My name is Sheila Collier. I'm the AVP of the Maternal Child Service Line here at St. Barnabas Medical Center. Welcome to the question and answer session regarding COVID-19 vaccines. The information you're going to hear today is based on what we currently know about COVID-19 vaccination. We are all continuously learning about COVID-19 and its impact on adults and children as the data is dynamic and changing at an incredibly rapid pace. We are truly living medical history. You may want to consult with your personal physician about your particular situation. With that being said, we have compiled a panel of experts to help you and your family learn more about vaccinations. Today, we have a distinguished panel, including Dr. Uzma Hasan, the Division Chief for Pediatric Infectious Diseases, Dr. Serena Chen, the Director for the Division of Reproductive Medicine in the Department of OBGYN at St. Barnabas, and Dr. Richard Miller, the Chairman of the Department of OBGYN at St. Barnabas Medical Center. We're going to start off with Dr. Hasan.
Thank you, Sheila, for inviting us and for the opportunity. So I'm going to give a quick, broad overview of what we are seeing with COVID nationally and in the adult and pediatric population, and who's getting hospitalized, and go from there. So as you are all aware, nationally, we've had about 39 million cases of COVID, 637,000 deaths in adults. And as far as New Jersey is concerned, we've had about 1.09 million cases, 26,000 deaths. As of August 30th, our moving average for the last 7 days of new positives is about 2,000 cases, which represents about a 5% increase over the last week or so. What we've seen in children is that in the last 2 months, there has been a 5-fold increase in children getting COVID. And to put this in context, about 38,000 numbers of children getting COVID in July, and we are up at 204,000 cases in the last week or so. The children between 12 to 17, we have seen about a 3-fold rise in hospitalization rates than what we have seen compared to the flu season. What we do know is if adults in a household are vaccinated, that has a protective effect on the children or so. And the couple other things that I wanted to talk about really quickly is in New Jersey, in our 71 hospitals, we've had about 175 patients in the last, within our Robert Wood Johnson system, and more than 1,000 hospitalized sort of within New Jersey. The key thing to know is that all viruses mutate over a period of time, and sometimes the mutations makes them more contagious. Sometimes it makes them give rise to more severe disease. And this is what we are seeing with the Delta variant, that about the Delta variant is about 2-fold more transmissible than what we saw with the Wuhan strain that was the original strain of the virus. Vaccination is highly effective in protecting from severe disease and hospitalization, anywhere between 97 to 100% effective in preventing death. So I think this is our biggest protection and our way to prevent ourselves from getting severely sick with COVID. With that, I will turn it over to you, Sheila.
So some of the questions came in were, is the vaccine safe, and can you guarantee safety from long-term side effects of the vaccines, specifically ADE and clotting?
That's a great question. So the vaccines go through a tough vetting process, and there are vaccine safety monitoring processes in place, which include the VAERS, which is VAERS. It's a vaccine adverse event reporting system. There's something called the Vaccine Safety Data Link, which compares baseline prevalence of certain processes or diseases to those associated with vaccine. And there's something called CISA, which is another safety monitoring system. What we do know is that the COVID vaccines have gone through a tough vetting process. We have seen certain side effects. Mostly these are local or mild systemic side effects that occur post-vaccination. You can see a little redness or swelling at the site of vaccination. And the systemic side effects like fever and chills, you will see more with the second dose with the mRNA vaccine within about 24 days out. And these are mild and self-limited. And in addition, the other side effects that have been reported, the allergic reactions, we see anywhere between 2 to 5 per million doses of vaccine administered for the mRNA vaccines. The clotting issues that have been reported with the Johnson & Johnson vaccine are anywhere between 1 to 3 to 6 per million of doses of vaccine. However, what we will have to remember is the actual illness increases about a 10 to 40% risk of DVTs and strokes. So if anyone were to get COVID illness, similarly with myocarditis and pericarditis emerging data, which is inflammation of the heart that is seen in young adults between 16 to 30 years of age, with the mRNA vaccines, we are seeing it's anywhere between 16 per million doses of vaccine. If anyone were to actually get COVID illness, they have about 1,000-fold higher risk of developing cardiac complications and requiring blood pressure support, having long-term damage. The vaccine-associated myocarditis or pericarditis is self-limited. These children or young adults have no long-term effects, and they're typically treated with drugs like ibuprofen or indomethacin. So the vaccine is highly effective in preventing hospitalization and long-term morbidity, and we have to remember that.
Thank you. There's another question saying, if I've already had COVID, do I need to get a vaccine?
That's a very good question. There's emerging data on how long natural immunity from infection does last. We do recommend that anybody who has had COVID illness should get vaccination. Vaccination boosts existing immunity, and that is the CDC stance as well, that we are recommending that anybody who's had natural illness should also get a vaccination to boost their immunity.
Thank you. And what about the recommendation with the flu shot and getting your COVID vaccine?
So you should all routine vaccinations should be administered as per schedule. You should go ahead and get that. We are seeing that the respiratory viruses have a little bit of an altered season. Viruses that we would not expect to circulate around this time of the year, we are seeing them make an appearance. Things like RSV, paraflu, adenoviruses, and I'm sure this has to do with the masking and preventive strategies that went into place. But all routine vaccinations should be done on time.
Thank you, Dr. Hasan. Now I'd like to move on to Dr. Chen, who's going to speak about fertility and COVID-19.
Or attending this webinar, because all of us here, we don't want to force you to do something you're not comfortable with, and we understand that there's still a lot of discomfort with this. So I hope this helps you and at least gets you to talk with your doctor about your personal situation so you can feel comfortable doing the vaccine. We know that the vaccine saves lives, and we know that COVID can kill, and the numbers seem very clear. I do want to address specifically, because I am a fertility physician, so I do in vitro fertilization. I help people with fertility all the time, and all of my patients that are trying to conceive want to be as healthy as possible and are concerned, should I get the vaccine or not? There was one particularly very damaging story that occurred earlier this year that was a completely made up story, but it exploded on the internet. And that's why I think a lot of people are concerned about fertility, because the truth is, when you look at the real data, and we have enormous amounts of real data now, the vaccine does not seem to have any negative impact upon male fertility, female fertility, or pregnancy, or breastfeeding. And in fact, COVID-19 disease has very negative impacts on pregnancy, male fertility, and female fertility. It can really have a negative impact on those things. So it's very clear to us, and that's why ASRM and ACOG have all strongly recommended this vaccine for people who are pregnant or trying to conceive, that the benefits of the vaccine really outweigh any small possible risks. But there was a story about the antibodies you make in response to the vaccine somehow having a cross-reactivity to placental protein called syncytium. And we have actually looked at that People have looked at the sequence of this placental protein and the sequence of the antibodies that are made when you get the vaccine. There is no homology. So that was just made up. So there's nothing about the vaccine that we think would impact your fertility. And then somebody asked, I think, before about fetal, is the mRNA vaccine made with fetal tissue? And it is not. It's a recombinant technology. But I do think it's important for people to know that, again, there is no truth to this story that the vaccine can impact male or female fertility or have a negative impact on pregnancy. But we do have strong data that COVID-19 disease can impact all of those things. So we want people to feel comfortable. So my patients that ask me, they're doing IVF, they're trying to conceive naturally. I tell them, just get the vaccine as soon as you can. You don't have to wait. You don't have to wait until you're pregnant or do it before pregnancy. Just do it now because the Delta variant is spreading like wildfire and we want you to be protected. We do say for our IVF patients, avoid getting the vaccine within 3 days of your egg retrieval or your embryo transfer. That's really our only restriction. So I hope that helps.
That helped, and that actually answered all the questions that we had ahead of time, Dr. Chen. So thank you so much. Dr. Miller is now going to speak about women and pregnancy, COVID vaccine and pregnancy.
There we go. Thank you, Sheila, and I'm very happy to have this opportunity to speak to the subject. I think it's something I'm very passionate about. So since the onset of this COVID pandemic, I think all the physicians and nurses and everyone who works in the medical center have been significantly impacted. And a lot of things that we've tried to do really is to try and improve infection control. And what I want to go back to and point out is that what Dr. Hasan and Dr. Chen has said is that one of the best ways to gain that infection control is to get the vaccine. Now, COVID in pregnancy is a substantial disease. One of the problems when we look at women who are pregnant and compare them to a woman who is not pregnant, same age, same health, the woman who's pregnant has a higher risk of severe complications. So overall, there have been 100,000 women who got COVID during pregnancy. 17,000 actually had severe enough disease where they had to be admitted to the hospital for oxygenation. About another 500 or 600 ended up going to the intensive care unit, and about 1% actually died from the disease itself. So it's a very severe problem. When we talk about what goes on with the mother, in those that have severe disease, that's where all the complications arise. They can have low oxygen levels. They can go on to develop a condition called preeclampsia, high blood pressure pregnancy that can cause a number of other problems. For the fetus, even though this is not a systemic virus, it doesn't get into the bloodstream and doesn't appear to go to the fetus in utero, but the maternal condition can be severely deteriorated enough to cause fetal death, can cause miscarriage, can cause preterm birth. All of those come as a consequence of the severity of the maternal disease. Now, those are the things that we know compared to when we look at, well, what do we see in terms of the vaccine data? The same sort of thing that Dr. Hasan just talked about, the V-Safe. The V-Safe, they've looked at about 30,000 women who are enrolled in the V-Safe program, and the information is coming back, and right now we have about 2,000 women who had a completely entire pregnancy following the vaccine, and when we compare them to women who did not have the vaccine, there was absolutely no difference with regard to preterm birth, with regard to stillbirth rates, with regard to miscarriage rates, so that they were identical in terms of all of those complications between women who got the vaccine compared to women who did not get the vaccine. So from the standpoint of looking, the disease itself is a substantial and problematic issue for pregnant women. It can cause lots of problems for the mother as well as for the baby. And then when the baby's born, the mothers who are infected prior to birth or immediately prior to birth can actually pass that on to the newborn. There's again, while a lot of the babies don't get infected inside the uterus, they can get early neonatal COVID by transmission from an infected parent. So again, infection control, the best way to get that infection control is with the vaccine.
Thank you. One of the questions that came in is if someone suspects they have COVID and they are pregnant, what should they do?
Well, first of all, remember, I just said that about 85% of women who have COVID in pregnancy will have either mild or no symptoms. And that's good news because for the vast majority, they're not going to have any of these problems. They're not going to have problems with the baby. They're not going to have problems with the pregnancy, and they'll go on to have a completely normal pregnancy. But they should inform their doctor. A lot of times, what we've done in our office is we have a telehealth visit with the patient. So we have an opportunity to see how they're doing, give them some precautions, and have them schedule additional follow-up as needed for any additional symptoms that they may have. But again, remember, if they get COVID, a number of those patients remain completely asymptomatic or have mild symptoms, but a small number will progress to get more severe disease.
I see them. Another question that came out is, are pregnant women recommended in the current booster?
So the answer is not at present. The only group of individuals where the booster is currently recommended by the CDC and the FDA is for those that are immunosuppressed. While there may be some immunosuppression in pregnancy, they're not included.
Okay, thank you. I can only see one in the chat.
Dr. Hasan, we have a question for you. Okay. When will vaccines be available for younger children?
We're eagerly waiting for that. So there are dose de-escalation studies, basically to figure out what the best dosing regimen will be for between 6 months to 11 years of age. We think that Pfizer will be probably first with its data, hopefully in the latter half of fall. For what we know for the other vaccines, we are probably looking at the beginning of next year.
Thank you, Dr. Hasan. Dr. Miller, there's a question, does the vaccine cross the placenta and does it induce antibodies across the placenta?
So the vaccine itself does not cross the placenta, and they've looked at that with a number of animal studies as well as human studies. It's a very small, the mRNA is a very small molecule, and once it's released into the system, into the bloodstream, it's broken down very rapidly. The half-life of that molecule is 6 hours or so, but it's not something that would cross over the placenta. However, the good news is when you get the vaccine and you induce the antibodies, you do get protection of the newborn through what is called passive immunity. So when the mother generates this one class of immunoglobulins, IgG, that actually has a placental transfer piece on that molecule. So it's picked up by the placenta, and the antibodies are passed over to the baby. So when they're born, they have some protection against that early neonatal COVID that I just talked about. So again, you remember when Dr. Hasan talked about the transmission rates and the infection rates, when you have 1 in 10 to 1 in 20 individuals around you that have COVID infection, that's a substantial number. That could mean that the baby could come in contact with that individual, the patient, the individual themselves could come in contact. So there's lots of sources for you to get that. So it's important not just for the mother to get the immunity, but also for that newborn to get the immunity.
Sheila, I see a couple nice questions in the Q&A also.
Can you read them, Sally? Because I can't see them. Sorry.
So those are there are now talks about booster shots or boosters engineered to specifically build defense for the Delta variant or just to increase antibody levels. Should we check antibody levels before considering a booster or a third shot? I'd love to hear what Dr. Hasan has to say about that.
I can comment real quick. So, the issue with antibody testing is that antibody testing cross-reacts, and if you have natural coronavirus strains, which are circulating in the community throughout the year, they also produce an antibody response. And the testing is not very smart to figure out the difference between the immunity generated via natural coronaviruses that are circulating versus vaccination. So we do not advocate for routine testing for to see if somebody has mounted a response to vaccination. The other thing is that there's something called the correlate of protection, which means that for certain vaccines, we know that a certain amount of antibody correlates with protection. For the coronavirus vaccine, the COVID vaccines, we do not know what that magic number is. So we are not recommending routine testing to see if somebody has mounted an antibody response.
Well, and I think too, Serena, to your point about the booster, I think the booster is intended to give an additional bump to the antibody levels, and that in turn provides you with added protection. Now, again, they have not made that specific recommendation so
you don't necessarily have to make different antibodies for each strain. We're just, yeah.
Right. It's the level of antibodies that you get. And it's those neutralizing antibodies that the vaccine produces that helps protect across the board, across all the COVID variants that we've come across so far. Isn't that correct, Dr. Hasan?
That's correct, Dr. Miller.
So and there's another question for Dr. Hasan. Oh, go ahead. Why was the Pfizer why was the Pfizer vaccine approved, but not the other vaccines?
Are you talking about for pediatrics for the 12 to 17, or is this?
I think for everybody. For everybody. Like Pfizer now is off EUA, but the others are not. Why is that?
I think, it depends on the number of participants in the vaccine efficacy studies, and if there is emerging data that is being evaluated, we really do feel that the other vaccines will follow suit very soon.
Yeah, from what I understand, the FDA's approval just means that they've completed all the submissions and review by the FDA panels. The Moderna, I'm told, will likely receive FDA approval within a few weeks. So, I think that they're both very safe and efficacious. And I think that your choice, it's dealer's choice. You get to pick which one you want. So. Sheila, there were a couple other questions that I saw. I'm
on a different computer. I'm trying to figure out how to roll it down. If you can read it, that'd be great.
So one of the questions was, if I'm pregnant, should I be wearing a mask? And the answer is, at this particular point, again, it all goes back to infection control. And so vaccination is first and foremost the most important part of infection control. The second part, though, is to make certain that you protect yourself against those who are unvaccinated. And that's where you run into the problem that you have these breakthrough infections. When you talk about a vaccine that has, a 97% efficacy, that means 1 in 30 will have a breakthrough infection. So it shouldn't be surprising that some people have breakthrough infections. If there's a lot of people in the community who've been unvaccinated and are infected, you probably should be wearing a mask in those circumstances. Don't you think so, Dr. Hasan?
I think that's very well summarized, Dr. Miller. I think the one other thing that I want everyone to know is with the Delta variant, your shedding of virus is about 1,000-fold more than you saw with the other strains. So that gives you an indication of how contagious this is, and hence you have to wear a mask to give you that added level of protection.
I think
Thank
it
you.
can be really confusing to people. So I usually tell people, when you're around people where you don't know their vaccine status, then you should wear a mask. So I think that helps. It helps to always have your mask with you and just throw it on. You don't know that person. They have like a 50% chance that they are not vaccinated. Those are the numbers right now.
Thank you, Dr. Chen. What about the long-term effects of the vaccine? How would you know if there are any?
So I can take a first stab at that. So, that's the point of all these vaccine safety committees, that anything that comes up which could be related to the vaccine is getting monitored. There are, like I mentioned previously, there are 3 safety databases in VAERS, Vaccine Safety Data Link, as well as CISA, which is CISA, which monitor that. In addition, the CDC put an additional level of protection, which was the WeSafe application that everybody downloads on their phone after they get their vaccination. And if you have anything that develops that you think is an adverse effect, that can be reported, and that is monitored on a regular basis. So I think the safety checks are in place. As things emerge, these organizations help us determine if this is the baseline rate of a particular event versus is this true related to a vaccination, and we go from there.
Let me just add to that, Dr. Hasan. So remember that the vast majority of serious complications from any vaccine comes within the first 2 weeks, period. So we have boatloads of information, boatloads, that say that it's absolutely safe because of all the patients that have been carefully studied and received the vaccine. The second part was, someone had asked, can this mRNA incorporate into our own DNA? And the answer is, there is absolutely no way that it can do that. So it doesn't get in there. It doesn't change your DNA makeup. There's no mechanism for this messenger RNA to reverse into DNA. DNA makes RNA. It doesn't go back into and then get reinserted into the DNA of our system. So there really is no change in our genetics. There's no change in the fetal genetics. None of those things ever occur with the vaccine itself.
Thank you. So we're coming close on our half hour. If I could go to each one of you and have you leave the audience with the one thing you really want them to remember. Could we start with you, Dr. Hasan?
Thank you, Sheila. What I wanted everybody to know is, in children who are less than 12 years, where we're still waiting for a vaccine, we are relying on the adults around them to be vaccinated. Let me give you a picture of what's going on in hospitals across the country. The kids who are coming into the hospitals who are less than 12 years of age are coming, or even between the 12 to 17 years of age, are the kids who are coming from unvaccinated or partially vaccinated household. If there is one parent who's vaccinated and another parent in the household is not vaccinated, your child is at increased risk of getting COVID and significant illness. So we have to do our due diligence to protect our children until vaccinations can be made available for those age groups. And I think that's the take-home message that I'd like everybody to get.
Thank you so much, Dr. Hasan. How about you, Dr. Chen?
So I just want to thank people again for coming and being open to asking your questions. Please, please get yourself comfortable, get information, make an appointment with your doctor, talk to somebody you trust. We really feel that the evidence is overwhelming, that the vaccines are safe, even if you're trying to conceive, even if you're pregnant, even if you're breastfeeding. We feel really comfortable. We didn't start out that way. All 3 of us have learned a lot in this last year, and you can too. And we're just here because we want you to be healthy and safe, and we want your family to be healthy and safe. So please just, get more information. Thank you for being here. We really do think getting the vaccine is much safer for your fertility than not getting it.
Thank you, Dr. Chen. And before you finish, Dr. Miller, I just wanted, there was another question that came in. This discussion will be recorded and available on the bridge for people to share with their family members. So Dr. Miller, do you have any closing remarks?
So I tell you that this COVID pandemic has been a tremendous burden to the entire healthcare system. Doctors, nurses, all the allied health professions, everybody has felt the impact. When patients ask me, do I think that they ought to get the vaccine, I tell them that I've taken care of some patients so sick and I worry so much that they aren't going to do well or even going to die. I think that everyone should consider that and should get the vaccine. Now, when they ask me if I had a daughter that was pregnant, would I tell her to get the vaccine? The answer is I have two. Two daughters were both pregnant during the COVID pandemic, and they didn't have any choices. I told them they had to get the COVID vaccine. It wasn't a discussion about should they or shouldn't they. I'm the father. I told them, I said, look, this is what you need to do. So that's what they, and that's what they did. So they both got the COVID vaccine, and it made me as a father feel much better too. So.
Thank you, Dr. Miller.
Yeah,
If anyone would
Sheila,
like-
I tell my
Yeah, go ahead.
patients, like, I don't sleep at night knowing you're not vaccinated. That's how we feel. We really feel that way. So please help us sleep better at night and get the vaccine.
Thank you, Dr. Chen. I want to let, if anyone would like to make an appointment, please go on rwjbh.org /COVID-19 vaccine or call the clinic at 973-322-5310. Thank you for your attendance today and thank you to the physician panel.
Thank you.